So Ron, is a very charismatic advocate for his community, for public health, a champion for our city, and a very devoted husband and father of his 2 children and grandchildren.
Ron Arias is that kind of person that's, he's always been active in the community. So though he had a trajectory as a professional where he was an activist when he was young and in college and all, he's also been an activist for the greater good of the community, especially people of color and people who don't have support in our community.
Ron is a very special person. He cares about the whole community. He recognizes everyone in the community, the diversity of Long Beach, the nonprofits, the city, the agencies, and really recognizes that working together with all the groups brings forward amazing results.
Ron's passion for this community has been evident since his early days of his career. Once he became the head of the health department, then he not only had the passion, but he had the power to envision plans that could make our community a healthier place for all involved.
He's very committed to Long Beach. He's lived here for many, 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 many years, raised his children here, and now his grandchildren are being raised here. He loves this city. He sees the potential, and he's very proud of what the city's done. He's committed his career to helping the city become what it is today in many ways. I mean, you know, he's retired, but he's not gone. And, you know, he could have chosen an easier retirement, but he chooses to still be involved and is really interested in what's going on. And I think that's wonderful, and we're very fortunate to have him in that position.
Ron has been retired since 2012, and he continues to dedicate his time by serving on boards and commission. Ron has dedicated his life to public health equity, to education, access, and to community service.
Because I think Ron, like many of us, he sees himself as a servant leader, that he's no better than those he serves. He is part of them, and he works with them to make the community better.
Ron, words are not enough to express what this community owes to you because of your passion and your leadership and providing both with consistency and integrity throughout your career. You're someone to be admired for all that you provide, and I think in providing the key to the city to someone, I can't imagine anyone being more deserving than you are. And on behalf of the Miller Foundation and the Board of Trustees, and especially from me personally to you, I'm saying congratulations, and I'm wishing you the best of health and good times in your retirement as you go forward.
Ron, congratulations on your keys to the city. This is a very proud moment on behalf of the community, and so well deserved. And so we continue to celebrate you and your accomplishments, and thank you so much for all you do for our city.
A key to the city that we will presenting to Ron. He's going to say a few words.
Wow. Thank you, Mayor Garcia, for presenting me with such a great honor. In '69, I entered Long Beach State in hopes of graduating in a couple of years. At Long Beach State, I quickly became involved in the Chicano student movement. We talked a lot about social, economic, and political equity. We wanted change. In 1971, my first job after graduation was at the East Long Beach Neighborhood Center, Centro de la Raza. Some of you remember it at the corner of Anaheim and Junipero. It was at the Centro, working with Rod Martin and Armando Vasquez Ramos, that we began to discover the disparities in healthcare for the Chicano community. We coordinated early health fairs because very few Chicano Latino families had access to health services. After my tenure at the Centro, I entered graduate school, and as the mayor said, I graduated with my MPA in 1974. After graduating, I went to work for the American Lung Association, where I had a wonderful opportunity to work with a group of leaders that launched the anti-smoking movement, and we created laws in communities and in local cities. And then shortly after, Proposition 99 was launched. We created a global anti-smoking movement, and it's still doing its job today. But in 1990, I was hired by Diana Bonta to come home and work at the City of Long Beach Health Department. This was my dream job, here in Long Beach, working to improve community health. At the health department, we built so many collaborations, working with the Children's Clinic, the hospitals, the community-based organizations, you name it, we were connected. We really believed that the health department was the community's department, and we wanted to extend our services to make those changes. I can say that in 2000, when Henry made me the director, it was an amazing opportunity. But then 9/11 hit. When 9/11 hit, the fire and police departments learned that they needed public health at the table. Soon after, we were receiving grant funds for bioterrorism planning preparedness. It was brand new, but our public health team learned new terminology, new skill sets, and we really worked to improve the cities. We set up pods. We set up mass vaccination centers. We used our annual flu vaccination program for training. I believe that this helped construct the foundation of today's health department. Kudos to Kelly Kalapi and Dr. Anissa Davis for guiding us through this extraordinary period confronted with the global pandemic. Needless to say, I believe strongly that a local health department is an incredible community asset. In closing, I just want to thank you again, Mayor, for recognizing my contributions to the city, to the city's health and well-being. I want to thank my amazing wife, Phyllis, who has been my rock and my confidant. This year, we celebrate our 50th anniversary. I also want to thank all of my former staff and friends who have worked with me along the way. I have always had great team members in doing God's work.